7 million on waiting lists, nearly 2 million waiting to find out what's wrong with them. Over 15,000 excess deaths tied to emergency delays in a single year. The NHS, still free, still believed in, yet only 26% of the public are satisfied with what it delivers. To understand how free healthcare became a national joke, you have to go back to the promise that started it all. In the summer of 1948, a new promise entered British life. The National Health Service Act of 1946 had set the terms: a health system open to everyone, paid for by general taxation, and free at the point of use. On the 5th of July 1948, this promise became reality. Aneurin Bevan, the Labour Minister of Health, stood at the heart of it. He had fought for a simple but radical idea: that healthcare should be a right, not a privilege, and that every person, rich or poor, would be treated according to need, not ability to pay. The launch of the NHS was described at the time as the biggest experiment in social service the world had ever seen. Its three core principles, universality, comprehensive care, and no bills at the bedside, were designed to erase the old fear that illness could bankrupt a family. The funding model, built on progressive taxation, aimed to make the system fair. Those who had more would pay more, so that no one would be left behind. For many, the NHS became a symbol of post-war hope, a shared commitment that the country would take care of its own. But a promise, once made, can outlast the conditions that created it. The belief in free care has endured, even as the experience of using the system has changed in ways that its founders never imagined. Public opinion now offers the clearest evidence that the NHS's promise and its reality have drifted apart. The British Social Attitudes Survey for 2025 records only 26% of adults are satisfied with the way the NHS is run. More than half, 51%, describe themselves as dissatisfied. These are not just numbers. They capture a mood of deep unease, where belief in the founding principle remains strong, but faith in the system's day-to-day performance has eroded. For many, the NHS is still a source of pride, a symbol of what the country stands for. Yet the experience of trying to use it, struggling to get through to a GP, waiting weeks for an appointment, or facing uncertainty over essential treatment, has become a source of anxiety and frustration. People are not rejecting the idea of free healthcare. They are rejecting the experience of trying to access it. The core contradiction is now impossible to ignore. The NHS is still free at the point of use, but access is increasingly rationed by waiting time, not by money. The anonymous patient, standing in for millions, finds themselves caught between the hope that the system will deliver and the reality that it often cannot. The gap between what the NHS promises and what it delivers is no longer a matter of debate. It is a fact, measured not just in statistics, but in the daily stories of those who still value the ideal, yet no longer trust the experience. The price of entry to the NHS is measured in time. In September 2023, the waiting list for hospital treatment reached a record 7.7 million people. That figure is more than the population of Greater London, and every name on the list represents a patient whose care is paused, whose life is on hold. By March 2026, the number drops to around 7.1 million, a sign of progress, but still nearly double the level seen before the pandemic. The reduction offers some relief, but not enough to restore confidence. The system's own standard, set in law, says that 92% of patients should begin treatment within 18 weeks of referral. That promise has not been met since 2016. In March 2026, just 65% of patients started treatment within that window, a target only reached after years of missed deadlines and political pressure. For the patient, the meaning is simple. The NHS remains free on paper, but access is rationed by waiting. The queue has replaced the bill. The longer the wait, the more the promise of universal care feels like a distant memory. Delay is now the most common currency in the NHS, and for many, it is the first sign that the system is struggling to keep its word. The journey into the NHS rarely begins with a hospital bed. For most, the struggle starts at the front door, trying to see a GP or find an NHS dentist. Every month, general practice records around 31.4 million appointments. It sounds like a system working at full tilt, but the reality is far less reassuring. Only 44% of those appointments are offered on the same day, leaving millions to navigate a maze of phone queues, online triage forms, and unpredictable callback systems. For many, getting through to a receptionist feels like winning a lottery, not a basic right. The problem isn't low activity. The numbers are higher than ever, yet ordinary people still find themselves locked out. The experience is defined by redials, dropped calls, and booking windows that vanish in minutes. Even when an appointment is secured, it may be weeks away, hardly the promise of care according to need. Dentistry tells a parallel story. In the 2025 to 2026 period, 18 million adults and 6.9 million children managed to see an NHS dentist. But these figures mask a growing shortfall, with many more unable to get even routine checkups. The NHS front door, once designed as the entry to universal care, now feels more like a barrier. High throughput and busy clinics have not solved the deeper problem. Access is still rationed, only now it's by time and persistence rather than by money. A diagnosis is not just a clinical milestone. For many, it is the moment when fear and hope collide. Yet in June 2026, 1.92 million people in England are still waiting for scans or tests, each one caught in a holding pattern, unable to move forward or find peace of mind. More than 400,000 of these patients have already waited longer than the NHS's 6-week maximum, a line that was meant to separate routine checks from dangerous delay. The backlog has grown by 500,000 since 2022 and stands 83% higher than before COVID-19. The numbers are stark, but the human cost is harder to measure. Uncertainty becomes a daily companion. The patient who once waited for a procedure now waits to know if they are even sick. Every day spent in the diagnostic queue is another day spent imagining the worst. Routine monitoring turns into weeks of anxiety, while symptoms linger or worsen. For some, the fear of what might be wrong is almost as harmful as the illness itself. The system, designed to offer reassurance, now delivers prolonged uncertainty. This is the hidden bottleneck of the NHS, the place where delay is not just an inconvenience, but a source of real suffering. The promise of timely universal care is replaced by a silent, growing queue of people waiting for answers, not just treatment. A&E is where the NHS's hidden pressures become impossible to ignore. The emergency department was once measured by a simple promise: 95% of patients seen within 4 hours. Today, that standard has been lowered to just 78% by March 2026. The numbers behind the doors tell a harsher story: more than 15,860 excess deaths in England in 2025, according to the Royal College of Emergency Medicine. Every delay is counted in minutes, but the real cost is measured in lives. Staffing gaps run through every corridor. Across England, 100,020 NHS posts sit empty, a vacancy rate of 6.7%. Among them are 25,500 missing nurses, leaving wards stretched thin and patients waiting on trolleys for beds that never open up. The emergency room becomes the endpoint of a system under siege. Ambulances queue outside because there is nowhere to hand patients over. GPs struggle to keep people out of hospital, and social care is so backed up that recovered patients cannot be discharged, blocking beds for those in crisis. Rising demand meets a chain with every link under strain. A&E collapse is not a separate disaster. It is the visible symptom of a health service where every part is overloaded. The patient who arrives in crisis finds that the whole system has already run out of room. Today, care is free but rationed by time, not money. The system handles record demand, yet patients face endless queues, missed diagnoses, and gridlocked hospitals. The NHS ideal endures in public faith, but the gap between promise and reality is now too stark to ignore. What breaks next?